The jejunal loops occupy most of the central abdomen. Therefore, it is impossible on ultrasound to follow systematically the entire course of the jejunum at once, especially if there is gas in the lumen of the GI tract. In this dog, we will be evaluating the jejunum crossing the abdomen from left to right, right to left, and traveling in the cranial to caudal portion of the central abdomen. Several intestinal loops are crossing each other and contain variable amount of gas that partially limits the evaluation of the abdomen. Occasionally, segments of colon are identified by their thinner wall in comparison to the jejunal segments. Frequently, the spleen appears in the near field. And as we go to the left side, the descending colon can appear. Moving centrally, the aorta is now seen dorsally. The scanning will be stopped on a segment of jejunum to best evaluate its layering. The aorta is again seen in longitudinal plane in the far field. Starting at the gas interface, we can see the mucosa, nearly anechoic, the submucosa, hyperechoic, and the muscular layer, thin and nearly anechoic, bordered by the hyperechoic serosa. Calipers are then placed on the serosal and mucosal interfaces to estimate the wall thickness, that is about 3 mm in this dog. The jejunal lymph nodes are commonly identified in the mid-central abdomen. We search for the cranial mesenteric vessels that are useful landmarks, and they can be outlined using color flow Doppler. The jejunal lymph nodes are located on each side of the vessels. They drain the jejunum, ileum, and pancreas. The entire chain is often difficult to fully evaluate if there is gas in the adjacent intestinal loops. Lymph nodes appear homogeneous and mildly echogenic. Cursors are placed to measure the thickness of these homogeneous nodes that were less than 5 mm thick in this dog. The ratio between the short and long axis of these nodes should be less than 0.5 in normal dogs.